Welcome to Health Pointers. Welcome to this video on food poisoning. Today we'll be discussing everything you need to know about this common health issue, including its definition, history, pathophysiology, signs and symptoms, causes, risk factors, treatment, epidemiology, and prevention. So let's dive in. Definition. Food poisoning is a condition that occurs when you consume food or drink that is contaminated with harmful bacteria, viruses, parasites, or toxins. It can cause a range of symptoms, from mild to severe, and can even be life-threatening in some cases. History. Food poisoning has been around for centuries, with outbreaks dating back to ancient Rome and Greece. However, it wasn't until the 19th century that scientists began to understand the microbiology behind the disease. The first recorded case of food poisoning in the United States was in 1919, when more than 100 people became ill after eating contaminated canned corned beef. Pathophysiology. Food poisoning occurs when you ingest food or drink that contains harmful microorganisms or toxins. These harmful substances can damage the lining of your digestive system, leading to inflammation and other symptoms. Some of the most common bacteria that cause food poisoning include Salmonella, E. coli, and Listeria. Signs and symptoms. The signs and symptoms of food poisoning can vary depending on the type of contaminant you've ingested. Some of the most common symptoms included nausea, vomiting, diarrhea, abdominal pain, fever, and dehydration. These symptoms usually develop within a few hours to a few days after consuming contaminated food or drink. Causes. Food poisoning can be caused by a variety of different factors, including 2. Eating food that has been improperly cooked or stored. 3. Consuming food that has been contaminated during processing or handling. 4. Drinking water that has been contaminated with bacteria or parasites. 5. Eating food that has been contaminated by animals, such as raw or undercooked meat, poultry, or seafood. 6. Eating food that has been prepared by someone who is sick or has poor hygiene. Risk factors. Some people are more at risk of developing food poisoning than others, including 1. Infants and young children. 2. Elderly people. 3. Pregnant women. 4. People with weakened immune systems, such as those with HIV/AIDS or cancer. 5. People taking certain medications, such as antibiotics or chemotherapy drugs. Treatment. The treatment for food poisoning depends on the type of contaminant you've ingested and the severity of your symptoms. In many cases, you can treat mild cases of food poisoning at home by resting, drinking plenty of fluids, and avoiding solid foods until your symptoms subside. However, if your symptoms are severe or you are at risk of dehydration, you may need to be hospitalized for treatment. Epidemiology. Food poisoning is a common health problem around the world, with millions of cases reported each year. According to the Centers for Disease Control and Prevention, CDC, there are an estimated 48 million cases of foodborne illness in the United States alone each year. Prevention. The best way to prevent food poisoning is to practice good food hygiene. This includes 1. Washing your hands before and after handling food. 2. Cooking food thoroughly to kill any harmful bacteria or viruses. 3. Keeping raw and cooked foods separate to avoid cross-contamination. 4. Storing food properly to prevent spoilage and contamination. 5. Avoiding eating food that has been left out at room temperature for more than 2 hours. Conclusion. Food poisoning can be a serious health problem, but it is also preventable. By practicing good food hygiene and being aware of the signs and symptoms of food poisoning, you can protect yourself and your loved ones from this common health issue. Thank you.